This is a CJASN podcast, and we are Dr. Marie Hogan from the Division of Nephrology
and Dr. Tetyana Masyuk from the Division of Hepatology and Gastroenterology at Mayo Clinic, Minnesota. Autosomal Dominant Polycystic Kidney Disease is the fourth most common cause of end-stage kidney disease and the most common inherited kidney disease, and most individuals develop liver cysts. Liver cyst and enlarged liver are also features of another disease, autosomal dominant polycystic liver disease.
In both conditions, polycystic liver disease causes immense patient suffering in some patients. As the liver disease progresses, the enlarged liver causes mass-related symptoms, compressing adjacent organs, and can be debilitating in a subgroup, especially women.
In previous clinical trials, monthly injections of long-acting somatostatin analog octreotide reduced liver growth by about 4% annually in people with severe polycystic liver disease.
In this clinical trial, we evaluated if monthly injections of a second-generation long-acting somatostatin analog, Pasireotide LAR, would slow liver growth in polycystic liver disease. Patients with severe polycystic liver disease were assigned in a 2-to-1 ratio in a 1-year double-blind randomized clinical trial to receive Pasireotide LAR or placebo.
Of 48 subjects randomized, 41 completed total liver volume measurements, 29 on Pasireotide and 12 on placebo group. From baseline, there was a reduction of 3 ±7% in high adjusted total liver volume over 1 year in Pasireotide LAR group, compared with increase of 6 ±7% in placebo group, with P less than 0.001 for both groups.
Total kidney volumes decreased 1 ±4% in the Pasireotide group, compared with a 4 ±5% increase in the placebo group, P again significant, less than 0.05 for both. Changes in kidney function were similar between groups.
Adverse events includes high blood sugar, 79% of patients in Pasireotide versus 27% in placebo group, with 59 developing diabetes in Pasireotide versus 7% in placebo group. In our previous octreotide study, while similar reduction in liver volume were associated with improvements of quality of life, in the current study, there was no improvement in quality of life, likely due to the high blood sugars.
In summary, another somatostatin analog, Pasireotide, was effective in slowing progressive polycystic liver disease. However, high blood sugar and diabetes in those receiving Pasireotide reduced its tolerability.
Our data from this trial and findings from previous octreotide and lanreotide studies suggest that somatostatin analogs have a favorable effect of arresting growth of both liver and kidney cysts and are a treatment option for symptomatic polycystic liver disease. Our trial was not powered to detect positive impact on slowing kidney function decline.
We are going to close this podcast by thanking the co-authors, Novartis, the sponsor, Mayo Clinical Trials Unit and Pyrenees Family Foundation PKD Translational Research Center, and most of all, the patients and their families for their commitment to participating in the study.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.